This is a patient of Dr. Panine's that we did surgery on about 1.5 years ago. He was a class 4 vertex, and we did about 4,700 grafts on him and rebuilt the front and did a little bit to the crown area of the scalp. And can you tilt your head down a little bit for us there? There you go. That looks good. And just look to the right and to the left. Good. Looks good. Okay. Prior to your surgery, what did you think about your hair loss prior to having anything done? Were you concerned about it then, or what was your whole outlook on everything back then?
I was very self-conscious about it, and I used different types of products to kind of hide the way that it looked and appeared to other people around me.
And what made you choose Dr. Panine for your procedure?
I looked around at a couple other companies and decided to go with Dr. Panine because I had a referral from another person, and she had indicated that he did meticulous work.
And how did the procedure go? Was it painful? How did you feel during the procedure and after the procedure? Was there any pain or discomfort with the procedure? I know it was a long day, but how did everything go?
I was completely comfortable. I was a little anxious about it the prior night, but the day of, I was completely comfortable, and the days after, I was also completely comfortable. I had no pain. And
How soon did you go back to work?
Within 3 to 5 days, I was able to definitely go back to work, and no one had any idea that I had taken this route to improve my appearance.
Did anybody ever say anything to you afterwards? Did you get any comments from people afterwards, like your hair looked different at all, or anything?
Mainly, like, what I got was that people had indicated that they thought my hair color changed, or that it just looked darker, but it wasn't like a shock to them. But at the same time, I knew that they were seeing something. Would you recommend this procedure to anybody? Would you have any thoughts if anybody were to say anything to you? What would you let people know? Hands down, I would definitely recommend this procedure. It was well worth the investment, and I would definitely recommend Dr. Panine to do this procedure because I have been very pleased with the results, and would... You don't even think about it being a transplant anymore, do you? No, like, it's like I can't even remember when I was where I had the thinning hair prior. Mm-hmm. Can you do me a favor? Just tilt your head down a little bit. Yeah. Okay. Now just slightly raise it a little bit and kind of look to your left and right a little bit. Just want to kind of zoom in on your hair and your hairline. There you go. Can you just look forward towards me? There you go. How about your barber? Do you go to the same person to cut your hair, or do you have special people that cut your hair now? That's a great question, because the person that saw me prior to this and after, he said if you wouldn't have told me that you had this procedure done, I would not have known. And I don't go to the same barber just out of convenience, but I've gone to other people and no one has ever mentioned anything. No, not at all, huh? Never. Even like family members that have seen you before and see you now, did they say anything to you at all? My cousin I think that they realized that I had gotten something done and wanted recommendations, but not like they don't know a difference necessarily because they don't see me as often. Mm-hmm. But previously, my dad would always kid around with me and say, like, your hair's thinning, but now he doesn't say that any longer. Mm-hmm. And you're taking finasteride right now, correct? Correct. And that's been working well for you too, right? Yes, and I started taking it prior to the surgery, and then I'm continuing to take it after the surgery because I don't want the investment that I made to go to waste. All right. Oh, it looks good. Looks really good. All right.
your head down a little bit for me. Look to your left. To your right.
Oh, I'm doing the opposite of the.
Ah, you're fine. Just straight ahead. Just want to get a good close-up of how natural that hairline looks.